Today we'll be doing something on introduction to clerking, and we're also going to do introduction to counseling for the Mdcn exam.
Okay.
So don't forget, the Mdcn exam has three major parts. There has two major parts. We have the OSCE and we have the MCQ. So in the aspect of the OSCE, there are some very important stations you need to take note very well. And one of the stations is the Clerking Station, and the other stations is the physical examinations, and other stations would include things like some cases you'll be giving, but above everything, the three stations that carries a very high mark is your clerking, counseling, and physical examinations. So today we are going to do introduction to clerking. So this is regarding Mdcn exam. So clerking is more like history taking. So here you are taking history from the patient. Yeah. So we're doing introduction to history taking, also known as clerking in Nigeria. Okay. So for you to clerk on the day of the exams, you have the examiner sitting there and you have the patient. So the first thing, we're going to pick it one after the other. The first thing you want to do is you want to do your introduction. You want to introduce yourself. This is very, very important. So your introduction first. First thing is your introduction. So your introductions, it includes you greeting the examiner. I want you to take note. So when you are talking about introduction, you want to greet. That's the first thing. So who are those people you're greeting? You're greeting the examiner. You greet the examiner and the patient. These are the two people you greet on that day. The examiner can ask for your exam number, you give your exam number. So immediately after you're done with this, you want to introduce yourself to the patient. This is very important. So you introduce yourself. Okay? Then after introducing yourself, you want to create rapport. How are you doing? How are you feeling today? Then you create rapport. Then immediately after you create rapport, you obtain consent for whatsoever you'll be doing. Obtain consent. Okay? These are the basic things you are going to be doing that day. These are the major things you're going to be doing. I want you to take note. This is your introduction. Doctors, your introduction actually matters a lot. Why? Because that day the examiner will be meeting a lot of people, and what will make you what will stand you out is how you introduce yourself. And even when you are introducing yourself, you must be confident enough. Your confidence is top notch. Please take note, your confidence is very important. Yeah. So you introduce yourself, you create rapport, you obtain consent. So after this, you move to the bio data. So before we go to the bio data, let's discuss how you introduce yourself. How do you do your introduction part? Let's say for example, this is for this path. You greet the examiner, good afternoon, sir. And you greet the patient also, maybe good afternoon, ma. This is for the patient. Then you introduce yourself to the patient. My name is Dr. So and so. You give your name, okay? So after your name, or let's say my name is Dr. Bob. Your full name, please. Don't just give Bob. Your full name, Dr. Bob Tony. Okay? comma. After this, the next thing is what? You create rapport. Okay? Or my name is Dr. Bob Tony, comma. Okay? I or have been asked to ask you, or for the purpose of this exam, let's say, for the purpose of this exam, comma. So that will be under the obtaining consent. Let's create rapport. You want to ask the woman, how, or the person, how are you doing today? Question mark. Then the next thing is the obtaining of consent. For you to obtain consent, you want to ask the patient, for the purpose of this exam, comma, have or I will like to ask you few questions about your health, comma, can I proceed? This is the consent. So this is the first part. This is what you do in the first part. Please take note, doctor. This is very important. This is what you do in the first part. Okay? So the next part is your biodata. So for biodata, people have acronyms for biodata. You can use the acronyms if you want. I will always advise you remember the acronym, so it will be easier for you when you are asking the biodata. So the first thing about the biodata is you want to ask about the name of the patient. Name. Okay, you want to ask about the name. You want to ask about the age of the patient. You want to ask about the occupation of the patient. Okay, you want to ask about the address of the patient. You want to ask about the tribe of the patient. Is the patient a Yoruba person? Is he an Hausa person or an Igbo person? You want to ask about the religion. Religion of the patient is very important. And in aspect of religion, if the patient is Jehovah Witness, a Christian, you want to ask which denomination, because some of the Jehovah Witness, they don't take blood transfusion. So when you ask the religion, you want to ask which denomination, if Christian. And apart from that, the next thing you want to also ask the marital status. Marital status. This is very important. Is the patient single or married? And apart from the marital status, you also want to ask the patient about the level of education. Education. So you want to ask the level of education. So in summary, these are the basic things you want to ask under the biodata. Okay? So after this, the next thing is the reproductive profile. If the patient you are clerking or you are taking history from is a female, it's very important for you to ask about the reproductive profile. Okay? This, if it's a female, the person you are clerking. Do you understand what I mean, doctor? If the patient you are clerking is a female, you must ask the patient about the reproductive profile. So for the reproductive profile for female, let me just put in bracket for female patients. For female patients. So you ask reproductive profile. So what are you asking under the reproductive profile? You want to ask the patient about the last menstrual period. You want to ask about parity. You want to ask about the estimated date of delivery. You want to ask about the EDD, expected date of delivery, or estimated gestational age. Yeah. So for the reproductive profile, you want to ask about the parity. Okay, this is very important if the patient has any child or not. You want to ask about the LMP, the last time the patient saw the menstrual flow. You want to ask about the EDD. If it's been a while, the patient saw the period and you think the patient is pregnant, you want to ask the patient, do you know the time you're supposed to give birth to your child if you're pregnant? And you want to ask about the EGA. The EGA is estimated gestational age. You also want to ask the patient if you know how many weeks is the pregnancy you are carrying. That is if the patient is pregnant. Do you understand, doctor? So at
Yes.
this point, do you have any question before we proceed at this point? Any question?
No question.
All right. So the next part is actually your, what's it called? The main part of the clerking. And this part also carries a lot of mark. It carries a lot of mark. This main part I'm going to do now. And here, I don't know if you've heard it before, they used to say for clerking, there are 5 C's you must follow. There are 5 major things you must follow. We are going to talk about the 5 major things. But before I talk about the 5 major things, I want you to note, if in your exam, you are given 2 symptoms or more than 1 symptoms, let's say, don't forget what you are going to do is you must have in your mind, you must have a working diagnosis in your mind for the purpose of this exam. But if you are given a single symptoms as a presenting complaint, the major thing you are going to do is differential. Please, I want you to take notes. So I'm going to write this somewhere later, but I just want you to know that the first thing is, in the case when you get to the exam hall, you read your question, you greet the examiner, greet the patient. In your exam question, there will be a presenting complaint in the clerking station. So the first thing is the presenting complaint. So for the presenting complaint is the thing that is going to be written in your exam questions, what the patient is coming with. Don't forget, if you are given 2 symptoms, if more than, let's say more than 1 symptoms, for Mdcn exam, you should have a working diagnosis. Right in your head, you should have a working diagnosis. A diagnosis you're already thinking that this might be this might be that. For example, if maybe you've been given things like cough and maybe cough and drenching night sweats, that is something like fever. So you should be thinking, oh, this is pulmonary TB. Does that make sense? So
Yes.
if you are given only 2 symptoms, have a working diagnosis. Maybe polyuria, polyphagia, polydipsia. You should be thinking of what, doctor?
Polyuria polyphagia, that be diabetes.
Yes, you should be thinking of DM. So just bear it in mind, if you are giving more than 1 symptoms, you should have a working diagnosis. But if it's only 1 symptoms you are giving, if one symptoms, you should do more of differential diagnosis. You understand? For example, epigastric pain. Maybe a patient comes and presents with epigastric pain. You do more of differentials. In this situation, you begin to, a lot of things can result into epigastric pain, cholecystitis, peptic ulcer disease, gastritis. You try to rule different things out. You understand, doctors? Please take notes. So now, the 5 C's that are very important. The first thing is your chief complaint. The chief complaint. Okay, we have the chief complaint, we have the cause of the disease, and apart from the cause, we also have other section, which is the causes. The causes, or let's say the risk factor. The causes and the risk factors are always interwoven, and risk factors. And the other part is the complications. And the last part is the care given. Okay, let's break this thing down. You've been presented with a 35-year-old woman or a 45-year-old woman with with history of maybe drenching night sweat and chronic cough. This is your case in exam. The first thing you want to do, you want to analyze the symptoms you are giving. So you have to know the chief complaint. You want to ask the patient, which one came first? Are you getting me? So you want to
Yes.
rule out the chief complaint. Or probably you want to ask the patient, if it is a single complaint, you still want to ask, what brings you to the hospital today? Why are you here today? Are you getting me? For the chief
Yes.
complaint. Please take note. So after you know the chief complaint, then you want to analyze this complaint. And how do you do this complaint? You analyze using an acronym called doctor. Okay? So the chief complaint, let me put an arrow here. The chief complaint and the cause are literally done together. Okay? Both of them are done together. Okay? So what do you do? How do you do them? So here, after you ask the patient about what brings the patients to the hospital, which is the chief complaint, you want to know the major thing. So ask about reasons for visiting the hospital. So the patient will tell you the reason why he or she came to the hospital that same day. Then you now analyze the complaint. So how do you analyze? Mostly we analyze using doctor. We'll explain there's other acronyms where we analyze using Socrates. That is if the patient is having pain. But if other symptoms, you analyze using doctor. So what do I mean by doctor? D is actually the duration. So you want to ask the patient, how long has it been? But based on the acronyms, it's logical to start with, like in practical sense, practical wise, you probably start with O, which is the onset. So you want to ask, when did you notice these symptoms? Are you getting me? Practical
Yes.
wise. But just for the acronyms, just for you to remember, just remember you start with O, and the acronyms is doctor. But practical wise, always start with what? Onset. So you want to ask the patient, when did you notice this whole thing? When did you notice these symptoms? When did it start? Then for duration, is how long has it been? The symptoms. This is oral station, it's not writing station. How long has it been? Then apart from that also, the next thing after the onset is the C. So this is the cause. Are you getting me? The cause.
Yes.
So under the cause, what do you want to ask under the cause? The disease, has it been getting worse, or let me write it. So onset, you want to ask, when did it start? Okay. Then the duration, you want to ask, how long has it been? Okay, don't forget. Then for the cause, you want to ask about the disease. Has it been getting worse? Is it worsening or getting better? And sometimes you might actually you might need to characterize your cause. Under cause, we mix up characterizing the symptoms and cause together. So if the symptoms is symptoms you need to characterize, you characterize it immediately after asking about the cause. Okay? So
Yes.
the next thing is the T. The T means the time. So you want to ask about the time. Maybe there's the disease or the symptoms varies with time. Maybe it happens at a particular time, or what time do you notice it? Does it just wake you up at night, or does the pain comes after maybe your food, or do you notice it after food or something? You want to know in relating to time. Then the next thing is your O. So your O is other symptoms. Other symptoms. So you want to ask about other symptoms that might be associated with this disease. Then the next thing is related phenomenon. Okay. So for the related phenomenon, could be other things that could be related to it also. Are you getting me? So this is
Yes.
what you just asked. Maybe somebody who is having cough. Cough may be related to things like drenching night sweat. You understand? So you want to ask the patient. So that is what you do in related phenomena. So immediately, once you're done with this aspect, the next aspect that you move to is your causes. So you've analyzed your presenting complaint. So after you've analyzed the presenting complaint, you've done the chief complaint, the cause. Next is the causes. So you now begin to rule out what could cause this. For example, somebody that you are given a case of maybe drenching night sweat and cough. You begin to rule out what can cause drenching night sweat. You start with the major one that you know can cause it. Things like what? Tuberculosis. You want to rule out pneumonia. You want to rule out HIV, and so on and so forth. So you begin to rule out the causes or the risk factor to that same disease you have been given. Okay, so let me do
Yeah.
that here. These are the 5 C's. We are following the 5 C's. So the next thing is what? Is your causes. So here, causes or risk factor. Risk factors. Okay, so after you've asked about the causes and the risk factor, you ask different causes as much as you can to rule out it. Don't forget this exam for this station, you only have 5 minutes. So you also need to be smart and fast about it. So immediately after the causes, the next thing you want to talk about is the complication. So complication. We're going to do some examples. So when we do some example, you are going to find it easier. So now I'm just giving an overview on how to go about any form of clerking. So once you have the idea here, you'll be able to clerk any case, any presenting case. Please take note. So
Okay.
yeah, so this is complications. After complications, the next thing is what? Care giving. So for caregiving, what you want to ask from the patient is, what have you done so far? Have you done any investigation? Have you visited any clinic prior to this time? Have you taken any herbal concoction? Have you taken any medication prior to this time? So whatsoever the patient has done prior to that time is what you want to ask in caregiving. Does that make sense, doctor? So
Yes.
after caregiving, the next thing is what? Is because I want you to take note, doctor. If
Yes.
if the case you are clerking is a gynecological case, for example, if the case you are clerking is a gynecological case, please hold on. If the case you are clerking is a gynecological case, you will actually need to ask the patient about the gynecological history and the obstetric history. Take notes. But if the
Okay.
case is just a male, you move straight to past medical history from here after the caregiving. Does that make sense? So
Yes.
now we are going to assume this is a male case. So we are just going to go to the past medical history. We are still going to get a case which is a female case, and we are going to do it, and you are going to understand the questions you need to ask under the gynecological history and the obstetric history. You understand, doctor?
Yes.
All right. So now let's assume this is just a male. Okay. So the next thing you want to ask is the past medical history. So for the past medical history, there's an acronym we use. We use SHADE. So you can remember what SHADE entails, what is in SHADE. So SHADE S is you want to ask the patient if the patient is a sickle cell patient, if the patient is aware of his or her genotype. So is the patient a sickler? You want to rule that out. Is it sickler or a sickle cell patient? You want to ask if the patient is hypertensive patient. You want to ask if the patient is asthmatic. Okay. And you want to ask if the patient is diabetic patient. You want to ask if the patient is diabetic patient. Apart from being diabetes, then the last one is the E, epileptic patient. So you want to ask, you want to rule out if the patient is epileptic.
Okay.
Okay. So these are the
Yes.
basic things you are going to rule out from these patients. Okay, so after asking this, the next thing you want to ask is the surgical history. Surgical history. So you want to ask the patient if the patient has done any surgery recently or prior to this time. So you want to rule it out also. Okay, please take note. You want to rule out any surgery. And after surgery, another thing you want to rule out is what? Any history of blood transfusion, history of blood transfusion. Please take note. You want to rule out things like any drug history. Maybe the patient has been on any drug for a long time, so any drug allergy. You understand? Also,
Yes.
you want to ask about any, let's just say, history of allergy. History of allergy. Okay? These are what you ask all together here. Surgical history, history of blood transfusion, drug history, any history of allergy. So you want to ask the patient to any drug or anything. So after this, the next is your what? Your family history. So for the family history, you ask almost similar questions here also. I want you to take note. You ask similar questions. So you also use the acronym. Same thing here. You also want to ask about Shade. So what do you ask? You ask the patient if the patient is sickler, if the patient is hypertensive, if the patient is asthmatic, if the patient is diabetic or epileptic. So these are what you also ask under family history. That's not all. So you want to ask still under family history the number of siblings, number of siblings. You want to ask about how many males and females they have in the family. You want to ask if there's anybody in the family that's having the same condition, the same illness, the same ailment the patient is presented with that very moment. You want to ask also. So you want to ask also this how many males, how many sisters, how many brothers. That's what I mean by males and females. Okay, sisters and brothers. Okay, so you want to ask if anyone in the family with similar illness. Okay, so after this, please take notes. If it is in a hospital setting, if you are writing, you might have to draw a small family tree. So you want to ask about the grandfather, the grandparent. But here, you don't have to do that in this exam. This Mdcn exam, you don't have to start writing all those things. Please take note. So after you're done with this, the next part is the social history. You ask about the social lives of the patient. Okay? So after social history, the next thing is the systemic review. What do I mean by systemic review? In each system, you try as much as possible to ask at least 2 symptoms from each system. For example, CNS, you want to ask about things like headache. Give me an example of symptoms on CNS, doctor. Headache and what?
Headache, seizure.
Okay, you want to ask about seizure. Okay, you go to things like, let's say, CVS. You want to ask things like what, doctor? Give me 2 symptoms in CVS.
Palpitations.
Okay, palpitation. You want to ask about
Yes,
what? Syncope.
syncope.
Syncope. Okay, and so on and so forth. Digestive system or GIT, gastrointestinal system. You want to ask about what do you want to ask? You want to ask about things like vomiting, right? You want to ask about things like what other thing? Give me other example apart from vomiting.
Constipation, nausea, diarrhea.
Yeah, constipation. Each system, endocrine system also same thing. Are you getting what I'm saying? Endocrine system, same thing. Musculoskeletal system. You also ask same thing. at least 2 symptoms in each system. You understand? Please take
Yes.
note. So at the end of this whole thing, you don't actually, normally, if it is in a hospital setting, you present your case. I hereby present a 35-year-old man, Mr. So and so. But here in this exam, you don't have to do presentation. After you ask everything, don't forget to thank the patient. That's it. This is introduction to clerking. Quick review. You introduce yourself by greeting the patient, greeting the examiner. You tell your name. My name is Dr. Tony Bob. How are you doing today? You try to create rapport. You obtain consent. For the purpose of this exam, I would like, let me remove, I wrote 2 double I here. I would like to ask you a few questions about your health. Can I proceed? You obtain consent. The patient says you can proceed. So the next thing is your bio data. So for bio data, you ask about the name of the patient. May I confirm your name, your age, occupation, address, tribe, religion, marital status, and education, the level of education. If it's a bachelor holder, a school cert, you want to know. Then if it's for a female, always ask about reproductive profile. So you want to know if the patient has any child, if he has been pregnant before. You want to know the LMP, the last menstrual period, the last time the patient saw the menstrual flow. If it is recent, you don't need to start asking about the expected date of delivery and the estimated gestational age. Then after you're done with this, the next part is the presenting complaint. The presenting complaint, what you do in the presenting complaint is if the symptoms you are given in your case is more than 1, you do a focus placking. You have a working diagnosis already in your head. If it is only 1 symptoms that you are giving, you do more of differential diagnosis when you are asking for your cause and everything. So first thing you want to do is the symptoms you are giving in your case, you want to analyze it. So the chief complaint, you want to ask about the patient, what brought the patient to the hospital today. Then you want to analyze the symptoms using the doctor. So I said doctor means duration, onset, the cause, the progression. Has it been worsening or getting better? The time, the other symptoms and related phenomena. This is what you use to analyze the presenting complaint. Then after the analysis, the next thing is your cause. So you want to ask the patient some few questions, anything that can result into the causes of that condition. Then after causes, you want to ask about complication of that same thing. We are going to do examples in subsequent videos, so it will be more understanding, like when we do some certain examples. Then after you're done, you want to go to caregiving. After caregiving, if it's not a female, you go to pass medical history. If it is female, you do obs and gyn history first. I'm going to explain the necessary question to ask in obs and gyn history in our subsequent videos. But if it's a male, you start with the past medical history. You ask if about see if the patient is sickler, hypertension, asthmatic, diabetic, epileptic. Then surgical history. You ask history of blood transfusion, drug history of allergy, family history. These are the question you ask. You ask also about this shadi, if the patient is sickler, if it's hypertensive, epileptic, and so on. Number of siblings, how many sisters, how many brothers, if there's anyone in the family with similar illness. Then you ask about the social history of the patient, the lifestyle of the patient, if the patient smokes or drinks. Then you go to systemic review. All system, 2 symptoms each, and you thank the patient. This is based on the marking scheme. Any question, doctor?
No, no question.
All right. In the absence of no question, I think that will be. Thank you very much. Okay.